This is Dr. Andrew Jones. In this edition of Veterinary Secrets, I'm going to be showing you how to naturally treat an aural hematoma. That's a big blood blister that would occur in your dog or your cat's ear at home. Hello everyone, welcome back to my channel. For those of you who are new, welcome. Today's video comes apart from a friend who called me. Their dog had a condition called an aural hematoma. And what that equates to is really a big blood blister, and it can occur in dogs or cats, more commonly in our dogs. Many of you may have seen it, and I would expect many of you watching this video have that specific problem right now. So an ear hematoma, an aural hematoma, what it is, let's just show you Pippi as an example, is you have a multitude of small blood vessels in between this inside part of the skin, the inside part of your dog or your cat's ear, and the ear cartilage. You can feel it, that sort of crunchy, firmer material that makes up sort of the solid structure to the ear itself. And what can happen, it can be originally, more often than not, we thought it was urgent, more often dogs with underlying ear infections. We wondered about sort of an injury, your dog's been running around and he scratched his ear. Now some of the thought is it's more allergic type basis, and we're wondering almost about an immune type reaction called vasculitis. Regardless, there's inflammation and there's bleeding that goes in between this part of the skin here, this fine little flap of skin here, and the ear cartilage. You get this big bump. So if you look up in the corner of the video now, you'll see an example of what an aural hematoma looks like. So in terms of diagnosing an aural hematoma, for the most part, there isn't really anything else that's going to cause this sudden onset, this big swelling in the inside of your dog or your cat's ear. And it looks like a big blood blister. So any of you who've had a blood blister, you're pretty much going to know that's an aural hematoma. And it's spelled aural, A-U-R-A-O. A few veterinarians, to confirm it, may put a small needle in it, draw a small sample of blood out, but generally there isn't anything else that's going to look exactly like that. So what are your options? Like, what can you do for an aural hematoma? For the majority of you, if you see this, yeah, your dog has or your cat has an aural hematoma, an big ear blood blister. In terms of your options, first going to see your veterinarian. Many of the veterinarians are going to suggest some type of surgical procedure, and there's a few different options. The most common one is where they actually put your dog, your cat under general anesthesia. They're going to incise the ear, such as Pippi's ear here, drain all that swelling of blood out, so it's immediately going to give some good immediate relief. But the surgical procedure would involve multiple sutures that go actually through your dog's ear, and what they're doing is they're occluding or tying off those small blood vessels, which are the sources of bleeding in the first place. So that alone could be pretty uncomfortable, pretty expensive, and not necessarily needed to cure the problem. Aural hematomas will go away on their own. So if you just leave it with your dog, there's one big option. If you don't do anything at all, eventually that blood's going to clot and it's going to get absorbed. Typically, it's better to know what is the underlying cause, and if your dog has an underlying ear infection or recurring ear infections, you need to treat that underlying problem. But if we're just dealing with that ear hematoma, one option is not do anything at all. It may take weeks, more like months, for it to be fully absorbed, and it may result in a fair amount of scarring, so your dog's ear is going to look a bit thick, sit a little bit funny, but eventually it will go away. One additional conventional option, and it's something I try to avoid suggesting that you guys use, but in this situation as opposed to surgery, it's a lot less costly, a lot less invasive, is the use of a corticosteroid, prednisone. And what many of the practitioners, and it was my experience in practice, have found that using sort of a relatively moderate dose of prednisone, that's 0.5 milligrams per kilo twice daily. So Pippi's about 20 kilos, that would mean she'd get about 10 milligrams twice a day of this prednisone. and it's given over approximately a 4-week period. You start a sort of twice a day dose and slowly lower your dog down on that dose. And most of these veterinarians are finding the bulk of the dogs with these oral hematomas are responding to oral prednisone. So the theory behind that would be that there's primarily an allergic type basis to it that's causing inflammation that's leading to bleeding within the ear. And by treating the allergic basis, i.e. using that prednisone, you're resolving it. But if we're thinking of this as an allergic type reaction or an immune mediated type reaction, then we can also consider some of the natural options as opposed to the prednisone. So the first one I'd have you guys think about is the use of a homeopathic. This one topically actually discussed just last week. It's an arnica cream. It's a combination homeopathic called Traumeel. A real simple, easy one to do, and you could just apply it on the surface of your dog's ear right on to where that oral hematoma is. So, for instance, applying it with Pippi would be super simple. Often this is where we're seeing those oral hematomas, just inside the pinna, the inside of the ear. I just rub it on top. And I would apply that 2 or 3 times a day. And I suspect if you did it, you'd see that oral hematoma. First of all, it would give some pain relief to it. Secondly, you'd see it resolving a little bit quicker. The next thing I'd have you guys consider using is this one herb licorice. And it's sort of seen as the natural type steroid. Which very much had me thinking that this would be a good thing to consider if we're trying to deal with this oral hematoma, this big blood blister that has an allergic basis to it. So this is a licorice tincture here. A pretty standard dose is about 1 ml. So I'll show you guys here, which takes you up about, it's marked on the dropper. So you may not, so where my finger is, there's a line and that's the 1 ml mark. So it's about 1 ml per 40 pounds of body weight twice daily. So that's what I'd be giving to Pippi. And generally you don't use licorice for any more than 10 days. So I'd be using 1 ml twice a day for about 5 days. Then back that off to about ½ ml twice a day for the next 5 days. And I would expect you'd see a substantial decrease in swelling. If after a 2-week period there's been no change, you could consider using the licorice at the lower dose for another 7 to 10 days. Now the third one, I don't have a sample to show you, but is curcumin. And there's a couple different options and why you would consider using it. First, we know it's a very potent natural herb anti-inflammatory, and it is helping many of the dogs that have underlying allergies. And that's where we think this has got the basis of it. So there's 2 ways you could be using curcumin. The first way would be giving the oral tablets. Once again, you want to use the capsules because they stain everything orange, and you're looking at the 95% curcuminoids. And we're looking at doses of 100 milligrams per 10 pounds of body weight twice daily. The big thing with giving it is, one, like I said, the capsule, you don't want to stain everything. Secondly, too, you want to make sure you're giving it with food. And knowing Pippi, that would be really easy to do. Yes, Pipster. And so what we know is it's going to help decrease the inflammation. By doing that, it's going to help, that body is going to then reabsorb that big blood blister a lot faster. The second curcumin option is there are a number of different creams now that can contain curcumin topically. So that'd be another way, and you could be fine to use them both, to use the oral capsules as well as the topical cream, and just directly rubbing it onto your dog's ear, onto the big blood blister. And once again, just do that twice daily. And the last remedy I want to discuss is the use of one of the essential oils. This is melaleuca or tea tree oil. And we know it's been very helpful for many of the dogs that have any of the ongoing recurring skin allergies. But the way you'd want to use it is diluted, so it's about a 2% application, and I would have you give it topically, so putting it on the surface of your dog's ear. So what you want to do is get an oil. Here I have 2 tablespoons of olive oil as a basis, and with that you would then take about 5 drops per tablespoon, so I'm going to put 10 drops. There's 10 drops of that tea tree. Really does smell medicinal, and I know it's one of the few things that Pippi won't eat, is Pipster. And I'm just going to dip my finger in it, and I would just rub You know, rub it directly onto your dog's ear. And once again, you could do that twice daily as another sort of last natural option. So thanks you guys for watching this edition of Veterinary Secrets. Thank you Pippi for being so accommodating. If you've yet to do so, I encourage you to subscribe to my channel by clicking up there. Then I want you to go ahead, click that link directly in the box below, and then when you do that and you sign up for my newsletter, I can send you my free books and my free videos on how to heal your pets at home with my top natural remedies.